Treating mental illness with pharmaceuticals has become the norm, but the side effects may outweigh the effectiveness. So, what if natural treatments eliminated pharmaceutical dependency? Tara Peyman, a naturopathic physician from the Arizona Natural Health Center, is here to explain. Thank you so much for joining us.
Absolutely.
Really valuable information. We hear a lot about mental illness in the news. How prevalent is it?
It's very common. Millions of people suffer with mental illness. In fact, 1/4 of Americans are diagnosed with a psychiatric condition every year. So that means if you're in a group of people and you look around you, 1 out of every 4 is likely to be affected by depression or anxiety or another psychiatric condition.
Okay, for people out there that may believe that they have a family member or a friend who suffers from this, what are the signs and symptoms? What do they need to look out for?
So if you or a loved one is experiencing symptoms of persistent sadness or irritability, changes in mood or behavior is really what you want to look for. Changes in sleep patterns, changes in eating habits, changes in energy levels, either high or low. That would be an important thing to look for. And then if those symptoms are significantly interfering with your life, either at home or at work, then that's when you should see a doctor.
And when it comes to treatment, now you focus on the natural treatment of mental illness. How do your treatments differ from, prescribed medications that a lot of people are used to hearing about?
Well, there are several differences. 2 of the key differences are, 1, homeopathic medicine is very safe. And then 2, homeopathic medicine actually treats the underlying cause of the condition. So as far as safety, homeopathy does not cause side effects. It's safe for use with conventional drugs. It doesn't interact. And it's also safe for use in children, which is so important because a lot of our kids nowadays are diagnosed with mood disorders. And then the drugs that are used to treat those mood disorders can actually aggravate suicidal ideation in children, teens, and young adults. So we need a safe alternative, and homeopathy can be that safe alternative. And it's also safe for use in pregnancy and in nursing.
Which is really
nice.
That's important.
Yeah, and as far as the underlying cause, it actually treats that underlying cause. Homeopathic medicine can stimulate a healing corrective response in the person on a deeper level, so it can actually undo the cause and help the person feel a natural sense of well-being. They can actually feel like their old selves again, which is really rewarding to see.
Definitely. Now, for people out there that, may be on medications being treated for this or have a loved one who is, and they also want to try homeopathic, can they work in conjunction so they don't have to go off their medications and try? I mean, how does that work?
Absolutely. It really works well. So a lot of my patients come into my office while they're on medication, and they can't just stop it because it's controlling their symptoms. So what we can do is leave that alone in the beginning, and then add a homeopathic treatment plan, which does not interact, it does not interfere, it just helps to stimulate better health and correct the problem from the inside out. And then while that's happening, if their symptoms get better, then that means that they're healthier and they may need less of their conventional medication. So then we can taper their conventional medication over time. And a lot of the time we can actually eliminate it. So in my practice, I'm a naturopathic physician, and in Arizona, I'm actually trained to manage and prescribe conventional medications in addition to natural medicine. So I use an integrative approach using
so on this table here, what are some of the things that, when someone comes to see you, they can kind of expect to see and to try?
So we use fish oil, which is there on the end. I use a multivitamin with most of my patients, a high-potency multivitamin. These are also methyl B12 and methyl folic acid, which some interesting studies have just come out to show that those are important for mental health. So I use those a lot for depression or for schizophrenia and for bipolar disorder. And then these are the homeopathic remedies, some examples of them that I use for all of my patients.
And when it comes to diet and lifestyle, that also plays a really important part.
Yes, it absolutely does. Healthy diet and an active lifestyle are the foundation for physical and mental health. So I always encourage my patients to eat a healthy, well-balanced diet with regularly scheduled nutritious meals, things with lots of omega-3s, with B12, with vitamin D, with folic acid, things like a spinach salad, blueberries, which are really rich in antioxidants and vitamins. So I always encourage that. It's very important.